this week. The U.S. Supreme Court will hand down its decision on the Affordable Care Act. Do you support the following components of the ACA? The requirement of insurers to accept and cover people with pre-existing conditions, allowing parents to keep their children on their insurance up to 26 years old, and the individual mandate. If you don't support these parts of the law, what legislation would you propose to address the need for coverage of uninsured Americans? Mr. Hudson.
Thank you. Well, we're all hoping that tomorrow the Supreme Court is going to eliminate the Obamacare problem that we're all dealing with, because Obamacare is not only going to bankrupt our country, it's not only going to destroy the best healthcare system in the world, but it's also destroying jobs right now. I talk to employers out there every day who have less than 50 employees, and they're very cognizant of the fact that if they get to 50, if they hire more people, then they fall into Obamacare. And so there are people out there not hiring because of this legislation. And so I'm hopeful that the whole thing will be overturned. To answer the question directly, what we've got to do is we've got to bring market forces to bear in healthcare. We've got to replace this one-size-fits-all government healthcare scheme that President Obama's put forth with ideas that bring market forces in. We've got to put the consumers closer to the physicians. They've got to understand the consequences of the decisions they make. They need to understand the cost. And then the costs have to be more transparent. And so I would support HSAs, health savings accounts for individuals. Then you can use catastrophic health care on top of that. I support having insurance companies compete across state lines to drive down costs. I support allowing small business owners to band together so they can buy insurance with economies of scale at lower rates like large companies can. All of these will drive down the market. Using market forces will drive down the cost of health care so that we can all afford it. And as far as risk pools and other ways to deal with uninsured, I think that needs to be pushed down to the states. I think that's the place to address it. And once we get the cost under control, it'll be a lot easier to deal with those issues. Thank you. Okay.
If you elect me to Congress and the Supreme Court doesn't do its job this week, I will do everything I can to completely overturn Obamacare and all of its parts. I do not think that Obamacare is good for anyone in this nation, even the people that may think that it's good for them. I don't think it's good for them. I think that the market force idea is the way to go. I think that we should have legislation that makes equal tax treatment for people who want to buy health care. This puts the consumers in charge, and this stops you from having non-billable health insurance that is tied to your employer. I think we should have tort reform that keeps doctors and nurses from having to practice some form of medicine that is based on covering their rear ends instead of doing something to make your rear end feel better. And I think that we should, at the federal level, make sure that states allow interstate competition so that if you want to buy a better plan that's in another state, you're allowed to do that. And all those things would bring the market, the free market, to bear on the healthcare industry, and it would make healthcare even better than it already is in the United States, and it would bring more healthcare to people in the United States. And I think that's all we really need to do. The reason healthcare has its problems is because of government involvement. It doesn't need more government involvement. All it needs is for the government to back out of the involvement that it already has, and that will bring a better product to the consumer and the patient. And it'll keep you able to interact on an individual basis, on a tailor-made basis with you and your healthcare providers. As a dentist, I see what it's like to have a patient come in and me be able to sit down with them and discuss their health care without having to worry about some bureaucrat in Washington telling the two of us what we can and cannot do.